Hello, everybody. My name is Craig Batista, and I'm going to be talking about informed consent today. So, what is informed consent? It defines the boundaries and clarifies the nature of counseling relationship between the counselor and client. I think it's imperative and really crucial in the beginning of therapy to clearly define the role, the processes, everything that's going to happen within the therapeutic relationship before it happens so that your client is aware and able to process that coming in. So I found a informed consent from a local practice in New Jersey in Montclair called Partners in Counseling, and specifically it was one of the therapists, Abby Scarlett Cooper. Their entire practice policies covered a lot, such as confidentiality and emergency situations, the process of therapy and evaluations, client satisfaction, discussion of treatment plans, vacations, what would happen to their sessions, Bill of Rights, financial disclosure. But really, in the informed consent portion, the counselor showed her name and her titles, the length of the session, their cancellation policy, how they would help them use insurance as a payment, the reasons to break confidentiality, such as court orders or litigation, duty to warn if somebody's harming themselves, others. It also included that the counselor was in supervision and that things in your personal session can be brought up in the counselor's supervision. So I thought that was pretty interesting, as well as the HIPAA regulations. I live in the state of New Jersey, so I looked at the consent covered under the state of New Jersey from nj.gov, and it covers medical care, transfers, communication information, medical records, cost of services, discharging, privacy and confidentiality, freedom from abuse or restraints, and civil rights. I feel that consent really spans across all these other fields. I have questions before going into something myself. So from the other role, I want my clients and the people coming into like either my practice or somebody else's to really feel comfortable before you go in, because they are coming in these situations that are either traumatic or trying or like the scary, most difficult parts of their life. So being honest and open as a counselor, I think, is really important. And some of the ACA requirements were purposes and goals, techniques, limitations, qualifications, continuation of service, and result of injury or death, implication of diagnosis, use of tests, fee and billing, confidentiality, records, rights or refusal. So there were a couple differences from the ACA and the state of New Jersey. So the differences were that the ACA recommends qualifications, limitations, continuation of services, implication of diagnoses, use of tests, and rights of refusal. And the state of New Jersey really just had two differences, and that was freedom from abuse and civil rights and discharging. So the ACA and the state of New Jersey have a lot of similarities with slight differences, but they really cover some of the core parts of informed consent, which is the information pertaining to the therapeutic process, the rights to records, fee of service, privacy, and confidentiality. So in Abby Scarlett Cooper from Partners in Counseling, she really covered a lot of this, but I believe that the privacy practices themselves, which was all one form, really covered everything. So when you're signing that consent, you're also agreeing to everything else within that packet. And for myself, my wife and I run an organization, and that's what we do as well. We have all of our kind of practice policies run up into that. I think something really important from the ACA was that informed consent is an ongoing part of the counseling process, and counselors appropriately document discussions or informed consent through the counseling relationship. So it's really a developing skill that kind of happens. Thank you, guys.